Well, welcome everyone. I'm Donald Weeks, founder and CEO of ClearPath AI and host of the Clinic Efficiency Podcast. Today, I'm joined by Dr. Shiri Sharvit. She's the founder of Resolve, and Shiri brings a background in psychology and relationship science into the AI space, building infrastructure that activates patients' existing social networks, spouses, partners, adult children, to improve chronic care outcomes between visits. What stood out to me is her framing that healthcare doesn't primarily fail inside the clinic, it fails between visits. Welcome, Dr. Sharif.
Hi, thank you so
Hi,
much for having me.
thank you. Could you tell us a little bit about your background and how Resolve came about?
Yes, for sure. Absolutely. I'm a clinical psychologist in my training with more than 20 years of experience in the field. My entire career revolved around working with people with chronic health conditions and trying to find ways for them to live a better life. I discovered early on, and my doctoral dissertation also was about that topic, that patients can't do it alone. The way that the healthcare system is built, prioritizes and optimizes this individual patient who sits at the doctor's office, nods, understands everything the doctor says, and then they come back home and just implement everything that they're told. Whereas in reality, we can't do significant changes on our own. Our brains are wired to seek the support of other people in our proximity, especially at times of distress. And
Mhm.
family members, adult children, spouses, home aides, friends are being engaged in and looked into the patient's recovery journey without structure and with no specific guidelines. So people work organically, spontaneously. Their engagement fluctuates and ebbs and flows, and they can't remain engaged over time without being burdened and burned out.
Right.
In the fields of weight management and eating disorders, I was one of the pioneers of looping in family members of adult patients. And I was always fascinated with how we can help families live together, because healthcare is a family issue and not a specific patient's problem in siloed and separation from other.
Well, you framed healthcare's biggest breakdown as what happens between visits. When patients leave with a complex treatment plan or are expected to execute it alone, when did that insight really crystallize for you?
There are two aspects. First of all, as a clinician who spent years watching the same pattern repeat, I was deeply frustrated with that and felt that the current solutions are inadequate. Patients left appointments with a clear plan, but then the hardest part happened at home, where decisions are messy, emotional, and rarely supported by the healthcare system. And I also experienced that as a patient with chronic health conditions myself, despite my many years of experience. When I was diagnosed about a decade ago with a chronic health condition that required attention and lifestyle changes and whatnot, I also, as a patient, really felt that it was difficult for me to manage my condition adequately. I had frequent flare ups, and until my family became engaged and involved in my care, particularly my husband. I went in and out of the hospital. And when he got involved, we were able to implement lifestyle changes in a way that I was unable to do before. And it was a crystallizing moment for me. I realized that we can't really do it on our own. We need
Right.
support as patients. So I really bring both the professional experience, but also the lived experience to my role at Resolve.
Well, I know there are thousands of apps and wearables generating data, but you've been clear that data alone doesn't drive behavior change. From a behavioral science perspective, what does information fail without structured social support?
That's a great question. I don't think there's one person to that can report that they've made a really sustainable change in their lifestyle or in their lives in general, just because a chatbot recommended it, or they got a really well crafted email nudge or text notification. It's just that
Yeah.
that's not how our brains work and how humans operate. Behavioral changes require a lot of attention. Environment is always much stronger than willpower. If if you and each of the listeners would think about a time where you engaged in changing a pattern that you recognized before, you knew it was not serving you, but it was entrenched. Most people
Hmm.
do this with the support of another person, but the support is oftentimes spontaneous. It's not structured in any way that people can use to their benefit over time. What we're trying to
Right.
do is really meet people where they are and help them facilitate healthier lifestyle and better medication management and managing of their and attending their visits and planned appointments on time, and as scheduled with the support of a loved one.
Yeah, it means a lot. And I know I've had the experience with that myself as a caregiver for my wife in her conditions. So, yeah, I know it is fundamentally the most important thing we can do is have that support right there all the time.
You know,
Um,
Donald, it's interesting. We've all had our shares of health management changes that we needed to do. We've all been also caregivers. There isn't even one conversation that I have in the past couple of months since I founded Resolve that people have where people haven't described their own experience as caregivers to spouses, to children, to adult parents. Oftentimes there's the guilt of not being in the same town or city as your
mhm.
family members and helping. But being a caregiver is a fundamental human experience.
Yeah, absolutely. Well, you've described the patient social network, the family caregiver givers, as well as underutilized force. How does Resolve structure that support in a way that maintains patient agency while adding accountability?
We really provide the AI infrastructure that helps patients with chronic health conditions and their family members follow treatment plans at home, manage medications better, close the loop on missing appointments and visits, help them understand what the treatment plan is and assign different roles to family members and responsibility so that
Mhm.
recovery and management of a chronic condition are not only the problem of the one individual patient. Therefore, we improve adherence and this way also reduce avoidable healthcare use.
Right. Well, what does that look like in practice for medication management and follow ups?
Okay. So healthcare really creates the treatment plans, but the execution, as we all know, happens at home. And most tools currently support one individual patient, and they have their additional burden of informing their family members and educating them. We take the EMR static care plans that have been crafted with much attention by the treatment team and turn them into conversations at the home using evidence based strategies and interventions to help families take part, an active part, in their loved one's recovery. The
Okay.
AI helps explain the intervention, help close the loop on missing visits and tests that the patient has neglected to complete for various reasons. It helps the family realize if there are any increased symptoms of pain, any falls, confusion, maybe medication mismanagement that leads otherwise to medication waste, and help
Mhm.
the patient utilize the right healthcare services rather than deteriorate at home gradually with caregivers feeling that their hands are tied, and then
Right.
coming back to the and then patients oftentimes deteriorate and end up presenting to higher levels of care. And we help them manage the condition better at home.
Our audience is clinics and operators. From their perspective, how does solving the between visit gap reduce operational strain?
So, healthcare today is just like printing directions from a specific map. You
Mhm.
know the guidelines, but there's no updates on what's going on at home and what families and caregivers. Sorry, what clinics inform us is that they feel that they've done their best during the visit and they send the patient with clear guidelines. But then they have no visibility as for what happens at home. Has the patient had any issues with showering or any additional management of themselves? Have they been really able to take the medications as prescribed? It's not enough that there's a refill indication in the pharmacy. You also want to know that at the home, people still continue taking the medications. The clinic's typical business hours are the times where family members work, and therefore there's a gap where family members cannot attend appointments or do not have the way to communicate with the clinic to inform them if there's been any changes. And therefore, with no visibility and no accountability and no way to impact execution at the home, they end up handling only the crisis
Right.
issues. Health tests and visits that were not followed through on, and then there's deterioration and no one has known anything about that before the patient shows up, or even
Right.
people not being able to be managed well at home and needing to be sent to nursing homes or to other care facilities where the family is unable to support them over time. The healthcare
Yeah.
system, this translates into lack of adequate care, and
Mhm.
none of us providers want to feel that we're not providing good enough care, but also fines by the insurers or the state if specific readmission rates are too high or specific metrics. Also, in terms of efficiency, many clinics are just spread too thin. Even if they do have protocols for how to support families, they just don't have the personnel to do that. We offer healthcare coaching for chronic care patients and using CPT codes that allow the clinic to add Resolve as an additional revenue stream for the clinic. Furthermore, in value based contracts, many organizations can get bonuses from the state or from the insurers if they meet specific
Mhm.
criteria, for instance, blood pressure or A1C scores, and we can help them ensure they measure these metrics and intervene at the home level early enough
Right.
in order to have that additional revenue stream.
Yeah, that's fantastic. I know, in our case, there was times when my wife's doctor, and this is after he's left the office, he would call while he's driving home
Wow.
and just to touch base. And there was times where it was good that he did because my wife was having issues with a medication that she had been given. And
Mm-hmm.
so he immediately says, "Hey, don't worry, we're going to change this. We're going to change the dose or whatever." And I think that was very important, and it would be very helpful for him to see that right away, that things are changing.
I think that that's first a fascinating story, and your wife's doctor's dedication is truly moving.
Yeah,
Unfortunately, not all providers or the majority of providers don't have that ability to, they don't have the bandwidth or the time or the resources to call their clients.
right.
This is not a intervention they're being reimbursed for. When you have huge patient case of and you have a huge caseload in your practice, it's really impossible to give that additional attention. What I think, that these additional reminders, because the healthcare recommendations are often static, it's a
Mhm.
printout or something, information that waits for you on the app to retrieve when you want. Then at home, things get weird and murky. And even if you thought that you understood everything at the doctor's office and you nod and everything
Mhm.
makes sense, then you come back home and your family oftentimes eats the beige diet, or you
Right.
live in a rural area where it's not safe for them to do the walking rehab that they were recommended, or they don't know
Mhm.
where to start, or a family member says, I can help you with cooking, but I'm still going to drink alcohol or use substances in a way that impacts your recovery. And they need that additional information, that additional layer. One
Right.
additional thing that I think clinics overlook just because they are swamped with other issues and other responsibilities and commitments is caregiver
Mhm.
burden. Studies indicate, and we all know this from our own lives, that being a caregiver for a loved one is, on the one hand, a highly gratifying role, but it can be cumbersome and tiring
Mhm.
and stressful. What we have in
Yeah.
Resolve is embedded, structured support for caregivers to address their caregiver burden in intentionally, so that they
Right.
can continue serving in their role in a sustained and healthy way.
Yeah. That's good.
Hmm.
That's very good. Well, you're building AI infrastructure in deeply relational contexts, chronic illness, distress, family dynamics. How are you thinking about trust, boundaries, and ethical guardrails in that environment?
As a clinician, have developing safe and responsible AI is a top priority for me and
Mhm.
my co-founder Lidor. We use only evidence-based interventions. We have a large data set of clinical sessions, treatment sessions with people with chronic health conditions that we use to fine-tune our algorithms. We test the boundaries of the AI and the services that we provide.
Mhm.
And I think one of the main issues today with AI and with the existing services is that there's no accountability. There's no emergency contact. We've heard all these unfortunate stories in the news of people taking their own lives following
Mhm.
conversation with AI or disclosing the true nature of their distress to AI, and there was no looping in or
Right.
informing in any sustained way, in a structured way, a family member or a loved one. When we
Right.
develop AI that works in the family level, you immediately have this emergency contact, the human who cares for another human and oftentimes
Mhm.
lives in and shares with them the same space, who can act quickly in real life with this
Mhm.
individual. I think humans have always cared for one another. And if we can reactivate that function of people towards other people in their real lives, we'll see benefits over time.
Yeah, that's good. Well, what's been most surprising as you've introduced this model to clinics or health systems? Is the resistance cultural or technical or regulatory?
To be honest, none of
Mhm.
the issues you mentioned in terms of the regulatory pathways, FDA has actually relaxed their
Mhm.
requirements of software as medical device class 2 interventions, and we're on route to receive that additional clearance from FDA. I think what we've encountered mostly is the interest in how to really engage families. Everyone,
Right.
talks about it. As I mentioned, everyone serves as a caregiver in one capacity or another, and
Mhm.
the idea that we can create the infrastructure to extend the work to the homes, to where the arenas and the spaces where healthcare actually happens over
Mhm.
time, particularly in chronic care. I think that we've encountered a lot of excitement in regards to that.
Okay. Yeah, that's very good. I imagine a lot of them are asking, well, how can we do this? How can we implement this? That's very good.
Yeah. So we work with clinics in understanding their specific user or understanding their specific client group's needs, where they
Right.
see the specific gaps, where
Mhm.
patients are frustrated and where families are frustrated. Remember that most of the interventions and most of the companies and the products now engaging families
Mhm.
focus on a specific subset of patients with Parkinson's or with dementia or Alzheimer's, where patients
Mhm.
cannot really take active part in their recovery. We
Right.
focus on that much significant patient group, those who do have the agency to take part in their an active part in their
Mhm.
um, health journey, and they want to have their family members there as supporters but not as guardians. And I
Right.
think this is a novel innovative idea for clinics. Sometimes it takes time to understand that everyone can be involved and everyone can be a participant in healthcare management at the home.
Yeah. Well, as you scale Resolve, what traction signals tell you that you're moving in the right direction? Is it adherence to improvements or caregiver engagement, reduced follow up burden, or clinic retention? What are your metrics?
For us, the main outcome measures are ROI.
Mhm.
We want to see that we're able to create significant impact on healthcare utilization, making sure that people utilize the right services, because we do want that don't want them to avoid healthcare. We just want them
Right.
to make sure they attend the right visits and complete the tests that they were assigned and take the right medications, and
Mhm.
they're not arrive later to higher levels of care and to hospital readmissions. So
Mhm.
this specific metric is the most important for us that we test. And the route to get through this is patients' acceptability, their engagement, retention over time. And we've learned that as long as both the caregiver and the patients are both engaged with the system, with both the human coaching and the AI coaching, we see better
Yeah.
metrics over time.
Well, if we zoom out 3 to 5 years from now, what does chronic care look like if your model works at scale? What disappears, what becomes automated, and what becomes more human?
I think that right now, patients work in silos. You get the
Mhm.
diagnosis. We've done, as a field, really terrific advancements in terms of imaging and decision support tools and whatnot. And what people often know quite quickly what they're facing and how to combat this condition or manage it better. But
Mhm.
where we're failing is the loneliness and experience that this is just too much for me. It's impossible for me to manage on my own.
Right.
My vision is to extend what I've already done as a uh, individual clinician, and then as a researcher, and then as an author in my book and my studies, to
Mhm.
extend the same interventions that I've seen working in real life with thousands of patients, and extend that
Mhm.
same work to millions and millions of patients and tens of millions. I think that uh, all chronic health conditions require family engagement. My vision is to have, to build this relational layer that healthcare has been missing, to help
Yeah.
communities and social networks rely more on one another, so
Mhm.
that healthcare would operate mostly at the home and not at the hospital. And the hospital visit would be specific and time limited.
Right. Right. Well, Dr. Shiri, thank you so much for sharing your insights today. I think this was incredibly valuable, and I really appreciate your time and openness.
Yeah, thank you so much for having me.